All right, we're live.
All right, thank you. Good morning, everyone. This is Senate Health and Welfare Committee. It is February 12th, 2 days before Valentine's Day. And thank goodness it's also Friday. So we look forward to our testimony today on S48, the nurse compact bill that we've been looking at. And then a little bit later, we'll be returning to our flexibility bill with some proposed language from the House on audio only and maybe another area of telemedicine. But we're starting in with S48, the nurse compact bill. Thank you all the witnesses for being here. I'm going to turn, Laura Pelosi, I'm going to ask you a question. Are you speaking also on behalf of the Rural Healthcare Task Force folks?
Yes, yes, the task force and our provider coalition.
Okay, so given that, and that Lauren Hibbert is not yet here, so what I'm going to do is I'm going to allow her to speak probably last rather than go first, and I'll let you begin sort of to offer the context for how the proposal might have, started in the first place. So
I'd be happy to. Can I share my screen?
Yes. Nellie, can you let her share?
I have it. Yeah.
You got it?
Yes. Thank you.
Okay.
Good morning. My name is Laura Pelosi, and I'm here on behalf of the Vermont Healthcare Association, which is the trade group for our long-term care facilities, which includes 37 skilled nursing facilities, 112 residential care homes, and 15 assisted living facilities. I want to just provide you some background today for why the Healthcare Association supports S48. About 3 or 4 years ago, the long-term care facilities, their priority quickly switched to a real concern over the crisis we have with our nursing workforce and the severe shortage of nurses that we have in our state. And I think certainly over this past year, all you really needed to do was turn on the television to really see or listen to the governor's press conferences to really see the impact of the lack of nursing workforce on long-term care facilities in our state during this pandemic. In 2019, the legislature created the Rural Health Services Task Force. I was a member of that task force. I represented long-term care facilities there. And I've provided links, and I believe I sent to Nellie this morning to post the full report and our workforce subcommittee report. I led the workforce work group for the very reason I just explained. The nursing shortage was a top priority for our long-term care facilities.
So just to indicate that the links do not work that we have for that. So
they should be posted on your website.
Those are the ones that don't work. So
okay,
we'll work on that later, and we'll.
I'm going to give you
some.
You
have highlights. The report.
Yeah, I'll give you some highlights from there. But
sure.
The demographic data, there's some lovely charts and graphs in there that demonstrates what I'm about to tell you. I don't think I need to tell you that we have an aging population. We're the third oldest state in the nation. That means we also have an aging healthcare workforce. And what you'll see in those slides is the data to back that up. You'll also see the significant decline that we have in the number of licensed professionals in our state. And one of the pieces, some of the pieces that the task force spent a lot of time talking about was the very tight national, regional, and local labor market when it comes to healthcare workers. We also focus very much so on the fact that we've got rising educational costs, particularly for our nursing programs. Cost of living and other factors play into our ability to recruit and retain workforce, including childcare, transportation, affordable housing, all of those economic development components. When we look at our nursing workforce levels, and this data comes from a variety of places, both Department of Labor data, as well as the Board of Nursing's annual relicensure surveys for RNs and LPNs. This is the current number of nursing-related positions that we have working in Vermont today. So just over 14,000. Our need, as we identified pre-pandemic as a rural health task force, was over 5,000 nursing related positions. And that was our need as of April of last year, so 1 year ago. We were absolutely correct that we needed to really do something and take a lot of steps to build this workforce. We were weak when it came to our nursing workforce coming into the pandemic, and I think the pandemic experience has showed us that we were truly right. And this is across the continuum. This is what the need is in hospitals, skilled nursing facilities, other long-term care, home health agencies, FQHCs, DAs, adult days, schools. I mean, everybody needs nurses. And I think the piece about the Rural Health Task Force, when we met at our first meeting, the nursing shortage quickly rose to the top of concerns in terms of the threat it presented to the sustainability of a rural healthcare system. Everybody needs them. So the impact on healthcare, I mean, I don't need to tell this committee, these providers, we can't cut operating hours. These are 24/7 businesses. We can't install the self-checkout kiosk like a grocery store or a Walmart. We have regulatory staffing requirements. So, if we don't have enough staff, we can't admit patients. And we saw that actually play out through the pandemic in terms of the impact on patient flow. In the late summer and early fall, the UVM Medical Center had 50 skilled nursing home level of care patients that they couldn't place because the nursing facilities didn't have enough staff to take care of them. And we had to approach the Joint Fiscal Committee for some funding so that we could pay crisis traveler rates to try to get some traveling staff to be able to open up, 40 beds in the Burlington area. I think this bar chart really illustrates really clearly what we're talking about in terms of the sustainability of the current situation that we're dealing with. At the time of the Rural Health Services Task Force, you'll see a similar chart in here that looks at traveling expenses, and that's combined for home health, hospitals, and skilled nursing facilities. The data we had at the time was for fiscal year 18. And the total cost for all three of those providers was about $75 million. The bulk of that in the hospitals, and here you'll see 12.5 million of that was at the skilled nursing facility level. A couple of weeks ago, I just got the updated data for fiscal year 19 from the Division of Rate Setting at AHS. And it nearly doubled, just about doubled in 1 year's time. And this was pre-pandemic. So just in the nursing homes, they went from 12.5 million to almost 24 million in expenditures for traveling nurses. And this is crippling these facilities. So, we don't have the numbers updated for hospitals and home health. I suspect during this pandemic, when we get those numbers in late summer, we'll see that this has doubled yet again for fiscal year 20. So the strategies are many. We need to grow our own workforce, on the front end. We need to make sure we're enrolling as many students as possible into our nursing programs on the front end. We need opportunities to upskill our existing workforce, LNAs to LPNs, LPNs to RNs, wherever possible. And then on the back end, we need to make sure when they graduate, that they have incentives and opportunities to stay and live and work in Vermont. And we want abilities. We need the ability and capability to attract nurses from other states. We are not going to grow our own way out of this when you look at the sheer numbers in terms of need. I worked just over this past week with our nursing programs and with the Office of Professional Regulation to get a sense of, how many nurses do we lose, to other states from our nursing programs. And this was actually not an easy task. And I really appreciate my colleagues who helped me put this together. But you'll see that based upon the retention rates, we have room to go, even with the number of nurses that we're graduating right now. So for the 2019-2020 graduating classes, we lost 255 nurses. It would have been nice to keep all of them, or certainly a greater percentage of them. And if you look at what the current enrollment is, 1278 in our nursing programs, we have the potential with those retention rates to lose 445 nurses. We need every single one of them. And, one of the incentives to keep folks is offering the ability to get a compact license. We are now, in my opinion, at a competitive disadvantage with well over half of the states, members of the compact. And I think Lauren and maybe Ellen are going to speak to some of the data that they've collected as part of their nurse surveys. But we need every tool in the toolbox to be able to retain and attract nurses. And we view the Nurse Compact as a key strategy in being able to do that. Along with that comes many of the things that the legislature did last year that I just want to remind us of. We advocated, and other recommendations from the Rural Health Task Force were to create a nurse scholarship program. I just heard the update from VSAC on this. We were able, and the legislature, I can't thank you enough, Senator Lyons and your committee, over $1 million into that scholarship program, and it has taken off like gangbusters. We're going to go through that money in the next school year. They had 60 days to get it up and running. They had 189 applicants, and they awarded 69 students for the spring semester. So they anticipate they can put 150 more students roughly through that program. So it's been really helpful. We also were able to modify the requirement to qualify as clinical nurse instructors. This has been critically important if we're going to be able to help grow this workforce. This means now that our skilled nursing facilities, their directors of nursing can work with VTC and Castleton and others to provide clinical nurse instruction and open up the placements for nursing students. So you'll see here the variety of things. All of this came out of the recommendations of the Rural Health Task Force, and the legislature took really meaningful steps. This year, passing the Interstate Nurse Compact is a top priority. It was a recommendation from the Rural Health Task Force. Our provider coalition supports it. And we're also, as you can see here, looking for a variety of other things. One of the other recommendations was a nurse tax incentive with like ongoing funding support for nursing, and then some work with the legislature to support programs that upskill our existing workforce. So I hope that provides at least a background and a frame for you to think about how critical it is that we take every step we can possibly take to attract, to recruit, and to retain our nurses.
Thank you for that. Is it possible that we could get a copy of your slide deck to put on our webpage?
Yes, and I believe I provided that to Nellie this morning as well.
Okay, well, I think she said she's having technical glitches and getting things up, so we'll look for it.
Okay.
I think what we'll do is we'll continue through with testimony, and then we'll circle back. So committee, keep track of your questions. Unless it's a question of clarification and understanding, let's hold our questions, and we can have questions and discussion after we've heard testimony. And so Lauren Hibbert is here. Lauren, I decided to hold you off until the end. I was going to sandwich everyone with you and Laura, so which I think makes sense. So unless you're have a time crunch.
I do not have a time crunch, Madam Chair, and I'm happy to be the other half of the sandwich.
Perfect. All right. Well, we have some great things to add into the sandwich. Thank you. So Ellen Watson is here as chair of the Board of Nursing. And Ellen, welcome. I'm not sure, you were here last session, I believe, right?
Yes, I was.
Yes, it's different on Zoom.
Yes. I was here on Zoom last year and then in person the year before.
Yeah.
So I'm happy to be here again.
Terrific.
Would you like me to
please introduce yourself for the record, and then I think we have something from you on our webpage.
Okay, so
not yet.
Thank you, Madam Chair and committee members, for inviting me to participate today. And I have a few thoughts to share from the Board of Nursing about the Nurse Licensure Compact, but I'll begin by introducing myself. I'm Ellen Watson. I chair the Board of Nursing and have for several years. I'm a family nurse practitioner and spend roughly half my work week seeing patients clinically in a practice called Apple Tree Bay Primary Care. And then the rest of my work time is devoted to educating new nurse practitioner students at the University of Vermont as a clinical assistant professor. Finally, in addition to serving as chair of the Board of Nursing, I've had the opportunity to do other service opportunities, including being on the Primary Care Advisory Committee for the Green Mountain Care Board and the Department of Health Opioid Advisory Group, several committees for the National Council of State Boards of Nursing, and most recently serving on their board of directors. And the National Council of State Boards of Nursing is sort of the origin of the Nurse Licensure Compact. So the Board of Nursing has the overarching task of working to ensure safe nursing care and to protect the people of Vermont from unsafe practice. We have taken up the compact issue many, many times, and we officially recorded a unanimous vote a couple of years ago to move forward with a plan to implement the compact. Since this is the second or third year that I've come before you, I'm sure you're familiar with the compact to some extent. So my testimony today is going to focus on 3 areas or issues that joining the compact could actually improve for the people of Vermont. And they are the provision of telehealth nursing services, staying current with national nursing healthcare trends, and that could absolutely, as Laura said, make Vermont a more attractive home state for both new and experienced nurses. And 3, while Vermont has several excellent nursing programs, and I work for one, the number of graduate nurses who stay in Vermont, again, as Laura emphasized, is not as robust as it might be. The compact could truly make it more attractive to stay in Vermont after graduation. So on telehealth, we all know the coronavirus pandemic has advanced telehealth as a method of providing healthcare substantially. From a Board of Nursing perspective, care of a patient takes place where the patient is, not where the provider is. Consequently, any healthcare provider who provides care to a patient in Vermont on the phone or via Zoom or whatever the format is, needs to be licensed in Vermont. At the beginning of the pandemic, many emergency rules were promulgated in many jurisdictions in an attempt to expedite the use of telehealth services. And if Vermont had been in the compact at that point, that would have been far less urgent and less necessary. Right now, and Laura mentioned this as well, there are currently 35 states in the compact, including our neighbors, Maine and New Hampshire, 10 states with pending action to join, including New York and Massachusetts, and only 5 states currently not contemplating becoming a compact state. So we're definitely going to be joining the majority of states that have become members of the compact. So you can probably see from those trends, the move toward borderless provision of healthcare is strong and vibrant. Providing healthcare in today's world demands nursing care be dynamic and evidence-based, as well as being able to safely cross jurisdictional boundaries. The current, in Vermont anyway, 100-year-old model of nursing regulation is not flexible or adaptable. It's truly unable to meet this need the way that it needs to be met now. The compact has been safely serving this need for a growing number of states for more than 15 years. The goal of public protection with all the safeguards that are built into state licensing are in place before a nurse is issued a multi-state license. The NLC, or Nurse Licensure Compact, has uniform licensure requirements so that states can be confident that nurses practicing in compact states have all met minimum requirements. You may know that fewer than 1% of nurses ever require discipline by a Board of Nursing. But if discipline is needed, swift action can be taken by the Board of Nursing regardless of the state where the nurse is licensed or practices. When a nurse is disciplined, the information is placed into the National Nurse Licensure Database, and all states that participate in the compact conduct federal criminal background checks to determine eligibility for a multi-state license. Many other healthcare professions are also establishing compacts to provide a healthcare system that's far better able to meet the needs of all healthcare consumers. And then my final point is a little bit more anecdotal, coming from my experience as nursing faculty at UVM. I generally teach in the graduate program, helping to educate new nurse practitioners. However, I also have and very much enjoy the task of teaching undergraduate direct entry students and graduate students about the Board of Nursing and nursing regulation. I do probably 5 or 6 classes a year on nursing regulation and the Board of Nursing requirements and such. I talk to them about their responsibility to know their scope of practice and the Nurse Practice Act rules and regulations for whatever state they end up working in. And we always talk about what constitutes unprofessional conduct and how they can behave appropriately to avoid committing unprofessional conduct and ultimately avoid disciplinary action. I ask them to raise their hands for those staying in Vermont practice and for those leaving the state. Initially, this was just out of curiosity. I was curious, especially as our classes have gotten bigger and bigger and bigger. But for the past 4 or 5 years, I have added content on the Nurse Licensure Compact. And I added a question a few years back asking them, if Vermont was a compact state, would that make it a more attractive home state? Almost all of them said it would be a much more attractive home state. Now, that is not to say that they would all stay in Vermont. I wish I could make that happen, but I can't. But it would be a plus and a benefit to nurses contemplating working in Vermont. It seems to me that anything we can do to make Vermont more attractive and a better place for nurses to work, the better will be our position to minimize the effects of a nursing shortage moving forward. So thank you very much. I am more than happy to answer questions when the time is right, and I hope that was useful.
Yes, thank you. That was very useful. And is it possible that you could send your written comments into Nellie so we can
Yes.
post it? Yeah,
Yes,
good.
I would be happy to.
And good luck with your survey.
Thank you.
So we'll circle back with questions after we've heard testimony. Deb Snell, are you there?
Yes, I am.
Oh, right, good. Thanks for being here. And I think we do have something from you on our webpage, don't we?
Yes, I sent you a copy of some work that was done a few years ago called the Labor Supply of Effects on Occupational Regulation.
Okay, Nellie, I'm not seeing it. It looked like it disappeared.
I can resend it as well.
Yeah, no, well, she's having trouble
Okay.
with the technology.
Yeah.
I don't think it's related to you. I think she has it. So
Okay.
we'll do you need a screen share?
Nope, that's absolutely fine. It's
Okay.
very, very long, but I wanted the committee to have the ability to take a look at it because it's a very, very detailed piece of work.
Okay, so why don't you go ahead?
Yes. So good morning. My name is Deb Snell. I'm president of AFT Vermont and president of VFNHP. I represent around 2,500 healthcare workers in the state right now. I am a nurse at the UVM Medical Center for the last 21 years, and the past 19 years, I've been a bedside nurse in the medical intensive care / COVID unit, which has been very interesting to say the least. Thank you for granting me the opportunity to speak with you again about the Nursing Licensure Compact. When I pulled out my testimony from last year, I realized it was also dated February 12th. So exactly 1 year ago today, apparently, we were discussing this same subject.
We have really good planning around here.
Apparently so, but I can tell you that my position or thoughts on the matter have not changed. And I appreciate Laura and Ellen's testimony. And what Laura spoke about, honestly, I agree with about like 96% of it. There are major issues in our state. And when we spoke last year about this, I cited many other states work on the same matter. I know Ellen mentioned that there are a number of states where it's in the legislation, and I can assure you that every nurses union in those states is fighting this compact. So I won't bore you with rereading my testimony from last year. I'd be happy to share that with you again, as it cites many studies and papers from, again, around the US about on this compact. So the one thing I want to continue to stress about the Nursing Licensure Compact is that there's still no evidence that after being around for 20 years, that it has actually worked or made any kind of significant difference in any state when it came to their nursing shortage. I believe one of the arguments made last time around was what would happen if there was a crisis and we needed to get nurses here. Well, I think the pandemic actually answered that question for Vermont and many states. When there is a crisis, states will open their doors and borders for emergency licensing, as our OPR did in the midst of the pandemic last year. In doing that, it did not bring nurses here who were going to move to our state. It brought in travel nurses who were making up to $125 an hour, plus up to $600 a week for housing. That's a lot of money to be spending, when our healthcare dollars are so tight in this state. So I would have to verify this with OPR, but at my facility, after the emergency licensure was granted by OPR, again, we didn't see that influx. Right now at UVMMC, and still in the pandemic mode, nurses have been calling. Nurses are still applying at our hospital. In fact, a conversation I had with our CNO was that, yeah, we're getting all kinds of applications from Florida and Texas, but you know what? People aren't accepting the positions here. Even with the amazing job Vermont has done during the pandemic in keeping our numbers low and being a safe state to be, nurses are still not coming here. And according to our emergency department nurse, she's offered more positions that have been turned down this year alone than in the last 5 years. And the reason for it was because of the salaries that we are offering in our state compared to the cost of living. UVMMC and the network is currently offering what they're calling a critical float pool of travelers that work between our hospital, Porter, and Central Vermont. Those nurses are being offered $5,500 a week plus housing to work between these three hospitals. $5,500 a week plus housing. You know, it's just really discouraging when you're a nurse who's been here forever, working your heart out, to be sitting next to someone who's making in 2 months what you might make in a year at the hospital. It's very discouraging for our members. And this nursing licensure compact is a dream come true for travel agencies, for nursing travel agencies. It makes them easier to move those nurses between states. So I would like to cite from the paper that will be shared with you once all the technical glitches are fixed. The name of the study is the labor supply effects of occupational regulation, evidence from the Nurse Licensure Compact. And it is a very detailed report, and I really encourage you. There's some math in there, which is not my favorite subject, but it really proves the point of my argument. And the results from the study say, our results imply the following for licensing and healthcare policy. First, while we do not find that the multi-state licensing provided by the NLC reduces labor market frictions caused by occupational licensing, it is important to note that we necessarily focus on nurses. The results may not be generalized to other licensed professions such as lawyers, therapists, etc. Second, from a healthcare delivery perspective, our results indicate that the NLC is likely not to increase the labor supply of nurses. We find no evidence that reducing licensing barriers will increase the pool of workers from which the hospitals draw, or that it will bring nurses into the labor force. As a result, this reduction in licensing barriers does not appear to be a solution to an aggregate shortage of nurses. So states that have been part of this compact from the beginning are still facing minor to crippling nursing shortages. What this compact doesn't do is fix why nurses are not coming to Vermont to begin with and why our current workforce continues to leave. The OPR has previously testified that it is not difficult to get a license in Vermont, and its study done in March of 2019 offers no guarantee that nurses will come to Vermont if the compact is passed. When new graduates are looking for places to work and they look at Vermont, they see that we are still high up in the number of nursing positions per capita, which means our positions are very difficult to fill, which is not attractive to nurses. And that when it comes to cost of living, I think we rank number 46 or 47th in the cost of living based on a nursing license. So when it comes to the nursing openings per capita, I mean, for instance, and I can give you, for instance, on our hospital website, we have a number of positions open for our operating room. We have like 12 travelers in our operating room right now at our hospital. There's only maybe 3 positions posted because the hospital doesn't want people to see we have that many openings because that would scare people off. So when we talk about positions per capita, that's exactly what I mean. So I do fear this compact passes that we will become a mecca for travel nurses who have a higher salary, similar health and retirement benefits, and housing allowances. We need to become competitive, period. Our southernmost states are already competing with Massachusetts and New Hampshire, and in invoking this compact will just make it easier for them to leave. We need a bipartisan solution to this problem. You know, I currently work on a retention and recruitment workforce at UVMMC in my role as the VFNHP president. And, you know, I mean, I wish the NLC worked. I wish that I could come to you with proof that this is really going to solve our problems. I'm just not seeing that. And the big question we need to ask is not even why nurses aren't coming to Vermont. Why are they leaving? Why are they leaving our state? Because the nursing licensure compact, if they're already leaving, will make it easier for them to leave. And until we figure out that problem, the compact is a pipe dream, in my honest opinion. So thank you for listening to me. I'd be happy to share previous testimony and this testimony and any information that I can share with you also. And I would also be happy to share any resolutions that we come with in the retention and recruitment process at UVMMC as well.
Okay, yes, no, thank you. I think your testimony on the bill itself is most helpful. And I know that you did send something to Nellie already. If your written testimony isn't in, we'd greatly appreciate having that as well. Okay,
Absolutely. Thank you, Senator.
yes, thank you. Meredith Roberts, I think you are next. My internet connection is unstable, so I hope I don't disappear or freeze.
Ah,
Go
that's
ahead.
why I sometimes have gone, if mine becomes unstable, I will wind up losing I'll put my picture to just the face, but it's stable at the moment. So I'm Meredith Roberts, the Executive Director of the American Nurses Association, Vermont. And we do weigh in positively for the compact, and we have really looked at this carefully and weighed the pros and cons of it. And I'll go through some of the things that we looked at. It does make perfect sense for, here we are, we're RNs, we all take the same NCLEX exam. Why don't we just be able to practice across the nation in the same way? Right now, it doesn't work that way. I was really surprised actually by that when I became a nurse, and the closest we have to that is the National Council of State Boards of Nursing, and that oversees all the individual state boards. But right now, all those boards have slightly different rules. This helps to make baby steps towards solving some of those problems. It's not going to happen immediately. So one of the things as we go forward, we need to be wise in how we decide to go forward. We can support this, but we want to do it in the smartest way possible. And that's what I'm advocating for. So we don't want to lose the control over our practice in our state. So I was very pleased that you have some stipulations there about only the home state can have the power to take adverse action against the nurse's license in the state. That is very important. We don't want to give up all our power, so to speak, abdicate that power, because we need to have some say in how nurses practice in our state still going forward. I had the opportunity this week to talk with the executive directors from nurses all over the nation. And I asked specifically if they had any advice when it came to implementing the compact, because many of them are in the compact. And so I was really interested to hear what their experience had been. And so most of them had a good experience. There were some that had not had a good experience. New Mexico had not had a good experience. With some real headbutting, but they had some advice. And one of the things was to make sure we had that single state opt-in, opt-out, which we do in this bill. So that's a wonderful thing. So people can decide to just do the single state license, not just the compact. They can choose one or the other. The costs of the compact came up as a concern. Right now, you participate in the compact, each state pays a flat fee. Participation rate right now is starting at the 6,000. We know Vermont is expecting the budget gap with the lost revenue from the licensure. So any of those single licenses will help to shore up that revenue loss. But we don't know, one of the things that came up, there's no ceiling for that compact administrative fee going forward. So one of the things that came up is there's a lack of a ceiling for the contract administration fee by the National Council of State Boards of Nursing. That was a concern. Another one was the lack of the tracking, that's who's practicing in the state, wanting to know who is here when they start practicing. And one of the mechanisms to solve that was suggested was basically implementing a data portal that could be done through the Board of Nursing. If the nurse is going to be practicing in the state more than a few weeks, that just has a quick thing of, their name, state of residence, and their area of practice that would provide the geographic data and let us know who's practicing in the state. Cost is a big issue. We've had the licensure cost in our state go up repeatedly, and it just went up, last year, the fee increase happened, which will, for RNs, they'll feel the impact of that this year when they do their relicensure, because it's in every other year. In Vermont, for RNs, it's 190, and I put down in the testimony, this is higher than our surrounding states. We have New York, they can get a state license for 3 years for $143. They have larger population. It makes it easier for them. Lower population states, it's harder for us to sustain that. But all of the states around us, we tend to have the highest in the area. And you can look at the details of that. That's a big concern. And it concerns me also that we don't have a cap on even a percentage of how much that licensure fee goes up each year. Right now, they're saying, okay, with the compact, it's not going to be an increase in the current, but then it's going to potentially go up another 50%, maybe $100 for each RN going forward. That is a burden on the nurses that are practicing, especially these new student nurses. And so we have to keep the costs of the nursing fees down. At least maybe we need to put a cap on the nursing licensure increase so that it can't go up so much every other year, because it is becoming a hardship for nurses. And they can take the same licensure test, the NCLEX, in Maine, in New Hampshire, and still practice, so we don't want to lose nurses. We want people to remain in the state. We want people to want to stay here and not have the highest licensure fees in the nation, or at least in the region. And we're close to the highest in the nation. Price gouging is a big, a new thing that I have been hearing about. And in the discussion, I was talking with the Organization of Nurse Leader, who you should have some testimony from. She was going to send on supportive testimony for the compact to you, so you should have received that. She had heard of price gouging from traveling nurses that was as high as $800 an hour. Compact nurses are not traveling nurses. So when we're going for a job and we get a compact nurse, they're not necessarily a traveling nurse. There is a difference between that. So we can get a compact nurse that's not a traveler and replace those fees. It reduces the cost of the onboarding. And Carol Conroy, the president of ONL, goes into that very well, and the details and the costs of how it's been a hardship for many of the nurse leaders across the state to be able to onboard people. And I've talked with people from corrections, I've talked as well as hospitals and different places, surgical services, all kinds of places where onboarding nurses has really been a problem. Nursing students are very supportive of the nursing compact. So we have a variety of people across the board that are very supportive of the compact. It's not just leaders, it's nurses, it's regular nurses that are supportive. Even when the Board of Nursing did their survey, and even if you looked at the resident nurses, it was over half did accept this was a good path to go. They were supportive of the compact. And if we could keep no fee increase, over 90% jump, it jumps to that level. So that's a big difference from the 52%, 53% to the 90%. That's the cost. So a few other small things. Of course, the telemedicine. So the telemedicine, it's easy to cross across borders. I do caution that, at the top of page 9 in the draft of the bill, the way I read that is we do have to be aware of practice across the state. So if a nurse in Vermont is doing telemedicine and they're practicing across the border, whether it be a New Hampshire or Maine, they have to be aware of the Practice Act in the state where they're practicing, because they're bound by those rules. So that can be challenging, and it might take education, some awareness of people, and more people will be doing telemedicine. So it's important for them to be aware of that impact and as we go forward, even in nursing curriculum. So that's something for Ellen to think about in nursing education. So, and that leads me into, I've heard good things about Ellen, so I've heard wonderful things about her, and I'm really pleased. One of the things that we look at in this compact, each state has only one vote in the compact in the NCSBN. So you get one state. In our state, it's going to be the head of the state licensing board. That's you, Ellen. So she will be the one that is the head, and she does have nursing expertise. She's from the Vermont State Board of Nursing. She's the executive director, but better than that, she has experience in the area of nursing. Going forward, I do want to make sure that we have somebody, that there's an ability to collaborate, because the mission of the Board of Nursing is not advocacy for nursing. It is for the public health. And I've been told that specifically, that the role of the Board of Nursing is not advocacy, it is public safety. Of course, nurses believe in public safety too, but we need to make sure that there's a way for collaboration for nurses to be able to have a voice, not just, we're a lot more than medication and practice in other ways. So I did put a little brief paragraph in here, just noticing that there was a final rule change that had happened that about dispute resolution that I was not sure if your legal counsel was aware of in their most recent amendment in January. So I did put that little part there about how the compact goes forward with final arbitration, because originally it had said it, you would abide with the final, the majority of the arbitrators, that decision would be final and binding. And now it says if they don't agree, then the commission gets the final determination. So that's something to just be aware of. I found that a little bit concerning. So in summary, we do support and feel that this is a good way forward to be supportive of the nursing compact. We would like to see a lack of a nursing increase, not just this year, but going forward in the future, that there's a limit on how much nurse licensure will be increasing, because that really is becoming more and more of a hardship for nurses, especially new nurses that may be first generation college students going forward. So maybe there can be some kind of way to have a support or some, there are a lot of different plans that we can have forward in how we solve a way to reduce the impact if it's a hardship for nurses going forward for licensure. But, maybe we need to consider that some nurses, it is hard for them to afford in the beginning, in particular, the cost of licensure. And if they're practicing in an area, maybe part-time, they may not have great amounts of money. And if they're trying to maintain their licensure and they're a retired or nearly retired nurse and they want to maintain their licensure and do a minimum of practice, if the fees are high, it will discourage them from continuing their license. We want to keep nurses in the practice. We need nurses to stay in the practice right now. We don't want to discourage them by having really high fees. So we support the compact. Employers are really strongly supporting this. Nursing students are really strongly in support of this. It facilitates the nurses from other states coming to fill the vacancies much more easily. It is appealing to nurses to have the flexibility. It may facilitate some salary improvements across border states, because now we are, you have somebody like UVMMC that's going to be competing with the salaries of costs where other states can go. So they have to maybe maintain better salaries and better conditions for their nurses so that it will improve the workplace for nurses. The students want to practice potentially in multiple states. I think that personally, in a pandemic right now, people will not want to stay in big city places. They will want to be coming to a more rural state. We've seen that statistically, and you see it in the real estate markets and everything else. People are wanting to get out of the cities. So I think that Vermont will be a very appealing state for people that want to get out of very urban areas, and they'll have a chance to practice in a different way. We're a beautiful state. We're an appealing state. We handled the pandemic well, and that benefits us. That makes us a more appealing state in a lot of ways for many people. Our low population, our low transmissions of COVID rates, the governor's done a good job, and thank you for that. Thank you for your support in helping him to do that. So it's not a silver bullet. It's not going to solve the workforce problem, but it'll make it easier for nurses to cross the borders, practice, and to have more shored up a workforce. I think it will benefit the workforce. And so for that reason, we see this as a good thing for Vermont. Thank you for letting me testify.
Oh, thank you, Meredith. I see that you have your hand up, Ellen. Unless it's a question of clarification, we're going to wait until after, and then we'll at some point we'll open up. How critical is the comment that you're making for 10 seconds?
It's a of something that was just said that I feel should be remedied, because it's a bigger deal to me anyway. Maybe.
Are you talking about the rule?
No, about,
okay.
I am not the executive officer of the Board of Nursing, and it is the executive officer who will either
Oh.
be the representative to the NLC or advise someone else to go in her place. So I just wanted, I'm the chair of the Board of Nursing, and as much as I would love the title, I don't have it, and I just wanted to,
We
that
got it.
was known.
We get it.
Thank you.
That was
Thank-
important. That was important.
Okay, good.
All right. And Ameren, I just a heads up on the rule change there that we're probably going to ask for your input at some point. But we don't need to do that today, I don't think, unless Lauren has something to add. So Lauren Hibbert is here from Office of Professional Regulation. You're getting to be a regular in the committee, and we appreciate your being here.
Good morning. For the record, Lauren Hibbert, Director of the Office of Professional Regulation. I'm happy to be a regular in your committee. I enjoy it. So thank you for having me again. I was going to share a PowerPoint. I don't know if I can be given sharing privileges or if I have them already, Nellie. I have them.
You have them. You've got them.
Thank you. Can you all see my screen well? Okay. So I thought I'd give a very, I listened to the testimony that you had previously on the compact this week. I noticed some questions. I'm going to try and address the majority of them and also go through a high-level presentation of the compact, somewhat similar to what I gave last year, but you do have some new members, Madam Chair, so I thought it would be helpful. First off, I think it's good to just say that a compact is something that we have. The state has many, many compacts, existing compacts that are familiar, but just part of our fabric of life. There's waterways compacts, and the driver's license is an example of a compact that is very common, very used in our everyday life. The nurse licensure compact is, it allows for travel between states without requiring separate state licenses. And as the previous testimony said, it's enacted in 34 states. One state allows for compact nurses to work in their state, but doesn't issue compact licenses. That's New Jersey. And there are 10 states that are currently have pending bills. Notably for us, Massachusetts and New York are among them. And there's currently pending in the State House right now, and Vermont is a House bill, and of course the Senate bill that we're talking about. Here's the current map. You can see the blue states is everywhere where the compact is enacted. Green is where it's pending, and New Jersey is that purple state right there with the partial implementation. There are many benefits to the compact. Of course, there's the possibility for increased workforce. We don't know, but for patients and employers, it's a possibility. And I have heard myself that if there was the compact, nursing students would stay. And of course, I've heard Ellen Watson give her compelling testimony about that as well. For patients and employers, it enables the continuation of care for patients across state lines. Obviously, this became really critical in a state of emergency. It also resolves lots of telehealth concerns. Currently, we are licensing many nurses who are not travelers, who are not ever intending to work physically in the state of Vermont, but do provide telehealth services in the middle of the night, those sorts of services. They're very popular for practices to employ, necessary, and everyone must have a license here to do that work. And that was existing before COVID. Obviously, COVID has shown the power of telehealth, but those services were necessary before COVID. For nurses, it allows a nurse to work in multiple compact states on one license, and it reduces red tape when you change employers along state lines if both states belong to the compact. For me, Dartmouth-Hitchcock is a compelling argument. You could even work at the same facility, Dartmouth Hitchcock, and depending on which location you're on, which side of the river you're on, you have to change your license. Or hold 2 licenses at all times, which of course drives up your licensure costs. For nurse educators, it does allow for larger use of online nursing education. As I previously stated, for states of emergency, it's helpful. This in COVID, I agree, we haven't seen a lot of nurses coming here. In fact, I've heard that we've even had trouble getting travelers to come to Vermont in the state of the emergency because there's such a high demand nationwide. A state of emergency isn't always a pandemic. It's easy to remember to think of a state of emergency as a pandemic right now because it's so omnipresent in our life. But Hurricane Irene, a localized health outbreak, we could have many things that could come up that would require nurses to come into our state in particular. And we would be able to draw nurses in that scenario. I think in a pandemic, even though Vermont has handled the pandemic very well, if the demand is so high nationwide, it's been hard to attract nurses to come here. For nursing boards, there are some benefits. The participating states can share more information about complaints and investigations before the final resolution of a matter. A compact state can restrict the privilege to practice on a license without any action from the home state. So this becomes important when we know that we don't want a nurse to be practicing in our state. We don't have to wait for the home state to act. It does reduce administrative pressures on nurses, but also the state licensing board for when somebody is starting a new job in a new state. And a compact state is part of the governance structure for the compact. And Ellen Watson was correct. It's the executive officer who would be part of the administration of the compact. I think that it's important, and it's important for me to state here that the executive officer is a state of Vermont employee, is supervised under state policy, and would be part of that overarching structure. So that is the way every state is. It's the executive officer of nursing. And I think being integrated into the fabric of state policy is important, and that state policy focus would be brought to the compact administration. A lot of times people ask, would there still be a Vermont license? And the answer is yes. Vermont would still offer a single state license or a multi-state license. And the primary reason is those 11 qualifications. One of them is that you do not have a felony record. And we want to preserve the ability for someone to hold a nursing license in Vermont if you have a felony record. We believe that people can rehabilitate themselves and should not be precluded from the workforce because of a felony conviction. And most states have a single state and the multi-state. So the concept of a home state is important. The home state is your primary state of residence. Where do you have your driver's license? Where do you vote? Those are key questions. And in the process, the compact licensee completes and signs a declaration of primary state residence. For me personally, this was the hardest concept to get around because I thought people would probably lie. I'm not always suspicious by nature, but I do understand that people lie. I want to be a Pollyanna about the world, but in this instance, I know people will lie. But I've asked this question a lot. Have you seen problems with this? And the people that I've asked have said they've seen a handful, but this is not a significant source of problem, significant source of concern. I saw that there were some questions about what happens if a nurse moves to another state. So this is when last year we were playing almost logic puzzle games in the committee. It was almost fun. So I tried to answer some of these questions. So if you're in a compact state and you move to another compact state, that means that your home state has changed. So you apply in the new compact state with the new primary state of residence and show proof of residency. A new background check is not required at that time. I saw that was a question that was raised in the previous testimony. If the move is to a non-compact state, then you would move, then you would apply for, the nurse would apply for the new single state license, and the compact license would convert to a single state license because she no longer, or he no longer would have a residency in a compact state. And if the move is from a non-party state to a compact state, then the nurse would apply for a compact state license, have to meet the 11 qualifications, and the non-compact state license where they're moving from remains unaffected. And I assume that's about as clear as mud, and I'm happy to answer any questions on that. But it's like a big logic puzzle. So happy to answer questions on that now or later, Madam Chair. It's up to you.
Why don't we, unless someone has a real strong urge to ask a question of clarification, we'll hold those questions.
Okay,
And I
thank you.
I don't hear any little voices, so,
Right.
okay, great.
So the qualifications for compact license are those 11 uniform licensure requirements. They're here. You still have to meet the home state's qualifications. So the home state can add additional qualifications if they choose. Vermont, the way Vermont law is written right now, there are no additional qualifications that would be required. You have to be a graduate from a qualifying education program. The beauty of the compact and why it works so well in nursing is the standards are very uniform. The education programs are very uniform, and the exams are uniform. So it would be hard to find a qualifying a program that would not qualify, but that is a requirement. You would need to pass an English proficiency examination. You would need to pass the NCLEX exam, which is the national examination. You have to have no active discipline on a license. That does not mean that you are required to have never been disciplined in the past, just you cannot have a restricted license in any way. You must submit to a federal and state fingerprint background check. You cannot be enrolled in an alternative program, and just a very brief thumbnail of the alternative program is we do have a program, I believe all 50 states of nursing have programs that are called something like the alternative program. They are a program where if you are having problems with substances or alcohol, you can call the Board of Nursing and say you are struggling and get assistance and support in rehabilitation without discipline placed on your license. You must have a valid US security number, have no felony convictions, and no misdemeanors related to the practice of the profession. So that can be a bit subjective for the state to define, but typically in this state, we define misdemeanors related to the practice of the profession, theft from someone who's vulnerable, or abuse of somebody who's vulnerable. And then you have to agree to self-disclose if you begin participating in an alternative program. So those are the 11 core qualifications that every compact licensee must agree to, and every state must agree they will require of the compact licenses. So another common question are there any impacts on the investigation process? Clearly, every Board of Nursing has a complaints investigation and prosecution side of their work to protect the public. And the answers are yes, there are some changes. So a complaint can be investigated in the home state or the remote state. So currently we have many licensees who are licensed in 2 states. And we may get a complaint about a person who's working in Vermont and licensed in Vermont, and we will start our own investigation. If that person is licensed in Massachusetts, we do not notify Massachusetts that we've begun an investigation. That's considered confidential underneath our statutes unless they request it from us. So the process of a of the compact is that it can be investigated in either the home state or the remote state, and the home state and the remote state can communicate throughout the process. Currently, as I said, we don't receive information about investigations in other states. We only receive the publicly filed discipline. So sometimes that introduces delay when we have somebody, as we have seen really, unfortunately, somebody struggling with diversion. They're working in one state, their conduct starts to become observed, and then they quickly move from state to state to state to avoid detection. And we do see this. With the compact, we can share significant investigations through an alert that's placed on the nurse's compact file. So, or we can directly call the home state without this alert system. But the alert includes, a significant investigation would be diversion of narcotics or sexual misconduct, significant theft. And then after official action is taken, the alert is taken. When after a nurse is publicly disciplined, the remote state can only affect the nurse's privilege to practice in the remote state. So if there is a nurse whose home state is New Hampshire and Vermont disciplines that nurse, we can only restrict his practice in Vermont. We cannot restrict his practice in New Hampshire. A home state can limit the nurse's ability to practice in the home state and all compact states. And the way that they do that is they take away the compact license and revert it back to a single state and discipline the single state license. So again, that's a little complicated, but it's a much more effective way to handle the situation where we have a nurse who's in trouble or intentionally avoiding detection and skipping from state to state to state to state, which we do see. Ellen Watson has seen these cases in front of the Board of Nursing where the state prosecutors are bringing 5 or 6 boards of nursing's actions that have been taken since the conduct that occurred in our state was reported, but it's just cumulatively catching up to the nurse who's starting to divert and starting to run into problems. There is a fiscal impact on the compact. I'm happy to talk about nursing fees. One of the key drivers is that the nursing board is self-funded. It's a siloed fund, and it's required to pay its share of the Office of Professional Regulation. For example, the administration costs, the operation costs, and then the enforcement costs. With the compact, it is anticipated we will lose fees. We will lose licensees, which translates to fees. And that number is anticipated based on our analysis to be 4,705 licensees, which results in almost $1 million of revenue reduction without corresponding decreases in expenses. Although we do anticipate, it's very hard to understand the impact on our enforcement costs. I do think our enforcement costs will be reduced. I can't calculate that in a number that I would feel confident representing it to the committee. We do think that our enforcement costs will reduce. There is a cost to being in the compact. It's $6,000 per year, and some technology changes in our system, which we're anticipating being $10,000 to $50,000. Now here, I will say that we will apply, if this bill passes, OPR and the Board of Nursing will apply for a grant through NCSBN. I don't believe that there's been a single state that hasn't received a grant from NCSBN, helping support some of these on-ramping costs, helping with the technology changes, helping with some of the revenue costs. States have received grants helping with those things. And then the other piece is, Ms. Roberts was right. We did just undergo a fee change that occurred in 2019 legislative session. It was the first time that fees had been raised in, I believe, 5 or 6 years for nursing. I will tell you, that was the very first year that I was the director of OPR. And I have promised myself that I will never wait that long as I'm sitting in this seat, to have a fee increase bill, because it was very painful. The decisions to not do it on an incremental basis meant that there were jumps that were very hard for some of our professions to adapt to. The other piece is, and this year would have been my fee bill year, but I did not think it would be appropriate to have any fee increases in this year. So we do not have a fee bill this year. I do anticipate that there will be one next year. I do not believe that nursing fees will go up in that fee bill, based on what I understand of our budget at this snapshot. OPR works as diligently as we can to keep fees low. We obviously cannot allow the board to enter into a negative balance, but we can control our overhead costs. We're doing as much as we can to focus on reducing overhead costs. So we are doing that. Some of the fee increases were in direct response to a technology upgrade that we are now at the tail end of, that was desperately needed, but we are at the tail end of. So I do not anticipate a fee increase for nurses, but I also cannot represent to you that there's not a fiscal impact. If we were not able to keep fees down and overhead down and resulting fees down, these are our current renewal fees, and it's anticipated that they could be raised if there is no reduction in overhead costs and enforcement costs. Again, just to say, I would not recommend adjusting fees before we understand exactly what the fiscal impact is, and before we make every effort to mitigate that fiscal impact through the CSBN grant, through reduction of overhead. Those are the things that we will have to focus on before we come back and ask for a fee increase. Outside of the fiscal impact, the other significant downside is that OPR and the Board of Nursing do have a decreased knowledge of who's actually practicing nursing in Vermont. Currently, a nurse must sort of check in with our state through applying for a license. That gives OPR the ability to connect with new people in the state, to inform them of the state-specific requirements or scope of practice changes. And the employer would need to stand in for OPR with compact licenses, would need to be able to notify them of what the specific state requirements are, or what who OPR is, and what OPR, how you would make a complaint to OPR, those sorts of things. The employer would need to stand in on that. And employers would need to understand the compact and the implications on the discipline process, who to report unprofessional conduct to, how to report it. I'm confident. I actually feel like this is a place where our smallness benefits us, because we're small and the employers are known, and there's a network that we could reach out to help talk through these things. Location has always been the concern for OPR around the compact, and also the benefit of the compact. It cuts both ways. As everyone said, New Hampshire and Maine are the only sister states that are part of the compact. If New York and Massachusetts have pending bills, if those bills pass, then Vermont would be very foolish to not be part of the compact, candidly. The more states in our location who are part of the compact, the more compelling it is that we should also be part of the compact. And the reality is, Vermont is a very small state with a lot of people who live on the borders of the state and receive care on the borders. COVID really showed the vulnerabilities with that, the vulnerabilities of the fact that there are major sections of Vermonters who receive all of their care outside of Vermont. And if which means that all of their providers before COVID could just be licensed in the state where they're receiving care. But with telemedicine, they all needed to be authorized to practice here. And this committee's done phenomenal work around that issue. Well aware of the issues that COVID brought up with telehealth. So thank you. So the OPR has evolved on the position with the compact as Ms. Roberts said. We did a large survey of all licensed nurses. I will submit that report to the committee in case you want to read it. But the board has always strongly supported the compact, and OPR also supports the compact because of its enhanced mobility and its ability to attract nurses to the state. I will say that OPR is the recipient of a federal Department of Labor grant that focuses on licensure, occupational licensure reform, specific to certain groups and certain professions. Nursing is one of our professions, and the groups include new Americans, people with criminal backgrounds, military spouses, and people who are chronically poor. So the compact really helps people who are chronically poor, displaced, be able to find a new job without having to also incur immediately the cost of an occupational license in the new state where they may be looking for work. The compact is an immense benefit to military families and military spouses and exiting military members. In fact, the Department of Defense has a whole division within them to support military families. And one of their top 3 objectives for military families is to promote compacts throughout the states. Particularly in nursing, actually, because I hate the term, but they have a term called the trailing spouse, which I think is the worst name for a military spouse. But the term is the trailing spouse, and military spouses are on whole female and are on whole teachers or nurses. And if you were going to make big bucket assumptions, which is how that on whole, that's why I'm categorizing it on whole. So it's a big priority for the Department of Defense. And then the other concern outside of the grant that really has made OPR support the compact is that we see from our licensing data, from our oversight of nursing programs, that we are not retaining nurses, and certainly not the amount of nurses that we want to. And I have similar statistics as Laura there and on my last slide. So on whole, the exact financial impact is unknown and will be monitored closely. We'll do everything we can do to avoid impact on fees. Other than financial, the downsides are minor, and many other states have mitigated those impacts. The survey that we conducted did indicate that a majority of Vermont nurses supported the compact. I believe it was at 53%. And the largest, most compelling argument for OPR and the Board of Nursing is we don't want to be out of sync with what's becoming the national model for nurse licensure. It is not a position that OPR would be proud to hold. So thank you very much for allowing me to testify. And I did share this PowerPoint with the committee.
Thank you. The PowerPoint is helpful in many different ways. It does give a strong outline for the bill, so that will help the committee as we go through the bill from time to time. And then your support of the compact is important. The fiscal information is something of concern that I think in particular, our finance committee will have to weigh in on. So I mean, it is a concern, just, you know, and I know that Senator Cummings has brought this up previously. So, it is 10:20. What I'm going to suggest is that we spend another 10 minutes, if necessary, on this bill, and to have questions of folks who have testified. And we've heard a lot of different pieces of information. I think that some of the, I'm gonna start with a question with regard to traveling nurses. That's been an ongoing issue, and how traveling nurses are paid versus how other nurses are paid. And I don't know if someone would like to weigh in on that. Aha, Laura, yes, please go ahead.
Thank you, Senator. I appreciate the question. And, you know, Deb is not wrong. You know, when you look at the bar chart I showed you in terms of the amount of money that just nursing homes are spending on traveling nurses, they're doing this because they don't have a choice, because we don't have nurses in our state that can actually fill the positions we need to run operations. But I think what's really important to understand is pre-pandemic, I mean, I think the pandemic has really shifted in terms of the crisis level of rates that providers are having to pay for traveling nurses. I mean, it is beyond extreme. And it is why right now we have nursing homes that cannot open up beds to decompress hospitals because they cannot even afford to hire traveling nurses. It's so extreme. If you take the pandemic out of it and look at those costs that I showed you, a doubling of traveler costs between fiscal year 18 and 19, just for the skilled nursing facilities. Here's the way it works. You know, the traveling agency has a certain hourly rate for a skilled nursing facility to bring on a traveling nurse for whatever that period of time is. You know, that traveling nurse doesn't make that full hourly rate. They get some portion of it, but what they really get is tax-free stipends for housing, for other living costs that the nurse doesn't pay tax on. You know, that's part of the overall benefit that the traveling agency gives to that nurse. So the traveling agency's employer costs, their payroll expenses and FICA is lower than an employer, than a hospital or a skilled nursing facility. So the employer's paying a higher tax for that employer, for that employee, and that employee is paying higher income tax on their salary. There's nothing we can do about that. That's a tax code problem, and it is an uncompetitive model when you look at it. Employers cannot keep pace in salaries to compete with what these traveling agencies can do when you factor in all of those tax-free benefits that are provided to that employee. When we look at salaries, one of the concerns I have, so our LPNs, the average salary for an LPN in Vermont is $50,000, which I believe is slightly above the national average. For RNs, the average, just looking at the Department of Labor data, and this was 2019 data, the average was in that low 70s for an RN. One of the real challenges we have is as those salaries go up, particularly at the hospital level, a skilled nursing facility will never be able to compete to hire an RN. A home health agency will never be able to compete to hire an RN. A designated agency who also needs nurses will not be able to compete. So as those salaries go up, at the hospital level, it really puts other providers in a serious detriment. So it is a factor that we are always looking at because it is a very tight local market in addition to being a very tight regional and national market. So I just hope the committee understands that we agree these traveling costs are unsustainable and we've got to find a way to grow more nurses that want to be here in Vermont to make our systems both financially stable in terms of our ability and sustainable to deliver the patient care we need to deliver. So there's not a disagreement there. I fully appreciate where Deb is coming from on that. And I don't think she'd get arguments from providers that the traveling nurse model is a good model for us. No dispute there. So I just wanted to make that clear.
So thank you. It sounds like we might have to understand better the traveling nurse funding piece And I actually would look to Senator Cummings and possibly her committee I don't know if there's a way out of that through a regulatory mechanism or not. So
I think it's a federal tax
it sounds like federal tax law.
issue.
Senator Cummings, did you want to say anything?
No, I actually had a question yesterday and that for
Okay.
Lauren Hibbert.
Go ahead.
Again, with the money hat. The one thing I noticed this year that I somehow didn't pick up last time was that this compact board has the power to incur debt. And I didn't see anything, there's one thing to take a short-term loan to meet salary till your fees come in kind of thing. But there's nothing that says they can't enter into a long-term lease or take out a mortgage because the board thinks they need bigger or better facilities. And one person can make that decision for the state of Vermont, and the Vermont is then tied to a 30-year mortgage, even if we get out. And I'm wondering what kind of local control. I'm sure the director of the Board of Nursing knows a lot about nursing. I'm not sure they know a lot about state financing. And nobody else could make that commitment for the state. So
thank you. I think that's a really good question, and I'll have to probably dig into it a little bit more and get some answers from the compact folks. But my understanding is the compact would be having that financial commitment, not the state of Vermont. The compact itself.
But Vermont is obligated to pay its share of debts incurred while we were a member, even if we leave the compact.
That's correct.
And so that's my concern. And I'm wondering, I know we can't change the compact, but is there some way we could put some stipulations around the power of our person, dog or cat? It's got to be a cat.
I can't say the word that I want to say.
Good
We have
thing.
got lots of very
Good
powerful
thing.
cats. Is there
Just
a way
knocked
we
over
can?
my whole water. I apologize.
Oh,
Hey,
that
do you
we
need a
can-
minute? Do you need a minute?
Can I just take 1 minute?
Yeah,
Yes.
please do.
I will leave it
Senator
at that.
Cummings-
I'm just looking for a fence at the local level.
Right, so
I
we'll
know you
ask
don't
that.
have a,
We'll get Lauren to come back at maybe.
I'll be here in
Yeah.
2 minutes.
let her
But
get
I want to
dry.
make sure we get to all the questions that committee members might have, and I see Senator Hardy's hand is up.
Thank you, Senator Lyon.
Thank you, Senator Cummings.
I
You
didn't
mean
do
her
it.
two- Go ahead, Senator Hardy, sorry.
It's okay. Well, one of my questions was actually for Lauren. So, but it may be interesting. Senator Cummings and I are both on finance, and we could take a look at the tax issues there to see. It may be insurmountable, but I do have a question. This testimony is extremely helpful, and just thank you to all of you for being so clear with your thoughts on this. But my question is, I feel like I've heard a little bit contradictory testimony about the whole issue of traveling nurses and whether or not the compact will help or hurt. And maybe it's just a difference of opinion, and that's fine. That happens in committee all the time. But I guess I'm still not clear in my own mind what I think after hearing from all of you. So I see Lauren is back, and so I'll ask my other question also, which is, I was confused by your testimony about the fees, because you said there would be a loss of fees of about $1 million if the compact were to go in, but then you talked about an increase in fees. So I'm confused about what fees would still be required of nurses in Vermont and who they would be paid to. So if you could clarify that and then comment on the traveling nurses thing, that would be helpful.
Sure, I'm happy to. And thank you so much for being such a wonderful committee and being able to handle my personal natural disaster in my office. With fees, because our budget is siloed, Senator Hardy, for the nursing board, all the costs, the administrative costs, must come out of those pooled licensing fees. And if we lose that number of nurses, resulting in almost $1 million of revenue reduction, then we still have to pay for all of those costs. So, you know, the costs of our building, the costs of our staff, the costs of our IT system have to come from fewer number of licensing fees.
Okay,
So
ask a clarifying question, Lauren. Sorry to interrupt you, but so
okay.
if we go into the compact, nurses who are applying for a license in Vermont can choose whether they get the compact license or the Vermont license. If they get a compact license, they pay the fee to the compact, right? Or do they
No,
pay?
they'll pay.
Go ahead.
They'll pay the fee to Vermont, but the people that we are anticipating losing is the nurse who lives in New Hampshire, who currently works in Vermont and has to get a Vermont license, because she will no longer need to get a Vermont license because she'll be able to work in Vermont with her New Hampshire compact license.
Okay.
So when we looked at our roster, we can almost exclude everyone who we license currently who is in a compact state.
I see. Okay.
And travels into Vermont to provide care or provides telehealth services in the middle of the night to a primary care practice, which a lot of our out-of-state nurses do.
Okay, but anybody whose home state is Vermont, when they pay for their nurse's license, they would still be paying it for Vermont. So the loss is only the outside of Vermont people. Okay.
Absolutely.
Got
yes.
it.
And
that wasn't clear to me. Thank you.
I apologize that I didn't make that clear.
That's fine. Thank you. And did you want to comment on the traveling nurse thing to clarify that?
I mean, I think it is the way that it will help traveling nurses is if you are a traveling nurse whose home state is a compact state, you will not need to get a license in Vermont. I don't think that that's going to change the amount of traveling nurses that Vermont actually uses, because my understanding is it's hard to get traveling nurses to come to Vermont. We haven't seen, even in the pandemic, a growth of traveling nurses. And part of that is it's a nationwide application of a pandemic, so, or worldwide really, but part of it is I don't think that Vermont has an unusual amount of traveling nurses either. So it will make it easier administratively for traveling nurses to operate in and outside of our border, coming in and then coming out. But it's not going to encourage them to come here. And I think in the scope of the compensation that they're receiving, the license fee, first of all, is almost always paid by the traveling company. And in fact, quite a few of our nurses, the license fee is paid by their employer. But whether they work for a traveler or for a Vermont facility, that's considered an employment benefit. So the fee loss of not having to pay for a Vermont license, that's, of all the things traveling agencies are paying for and contributing to, that's not the make or break mark for them. At least that's my assessment.
So I'm going to, I know that Deb Snell had put her hand up to also respond, and I need to leave the committee for a few minutes. Senator Hardy will be taking over, and then I will be back. So my suggestion on this one is to go no longer than 10:40 and then take a break until about 10:50 or so, take a 10-minute break, and then we'll see where we are when we get back. And Jen Carby has some new language for us for our flexibility bill. We need to get to that. Okay, so it's all yours, Senator Hardy.
Thank you, Senator Lyons. Deb, did you want to comment on that? I saw your hand up.
Yeah, I mean, just because I worked alongside a lot of these travel nurses during the pandemic and before the pandemic as well. And I mean, even during the pandemic, Vermont could not be competitive enough to bring nurses here. I mean, there were travel assignments available in New York City for a 13-week assignment offering $100,000 during the pandemic. So even at that point, and Meredith brought up a good point, and unfortunately, and Ms. Pelosi brought up a good point too. It is about wages, unfortunately, and it's not necessarily about wages to, like, for me, I make good money. I've been a nurse for 20 years. I make good money now, but someone starting off in nursing, this is not a state that they can afford to be in. They can't afford to live here on top of mortgages, housing costs, and their educational fees. And when Lauren was even talking about the New Hampshire nurses and going to Dartmouth, Dartmouth pays more than us. That's why nurses go there. Even our technical professionals that work in our X-ray department are going to Dartmouth because they're paying $7 to $9 an hour more. So it really, it behooves us as to figure out how we can be competitive, period. Even with or without the compact, we need to figure out how to be competitive and keep nurses here, period. Thank you.
Thank you. Laura, I see your hand. I want to see if there are any other committee questions from committee members before. Okay, Laura, go ahead and, Senator Hooker, did you want to ask a question?
Yeah, just a quick one of Lauren. Lauren, you mentioned the money that would be necessary for upgrading tech, and you said between 10 and 50,000. I mean, I guess it's because there's uncertainty about how much these things will cost, but what do you anticipate having to be done to?
Well, so that slide, I should have updated it. Last year when I spoke before the committee, I said 10 to 50,000. I think it will probably cost 15 to 20,000 because we will have a whole application path that we need to create and establish in the system that does require some development work from computer folks. We will need to work with VCIC on criminal background check information streamlining because this will require all the nurses in the state to get background checked. There will be a process that will be complicated and a little challenging operationally to get our 18,000+ nurses criminally background checked. And we have been working on that conversation steadily with VCIC, the Vermont Crime Information Center. But it will take time, and we will have to partner with the facilities to do criminal background checks in batches. We will criminally background check all of our nurses once the compact is effective. That's been a long-term policy goal. We have the authority to do it now, but it is a lift that is substantial, and that technology integration with VCIC, to the extent that we can, is going to cost some money. But criminal background checks are very controlled by what can be transmitted electronically. So we will not be able to fully integrate electronically. Paper appears to be the preference for criminal background checks.
Thank you.
Okay. Laura, did you just have one final comment unless there are committee questions?
I had just one quick comment. It really is in response, and I think dovetails with Deb's point, that it is about the new nurses and the salaries we can pay new nurses. And I would really encourage this committee to consider the governor's proposal for that nurse tax incentive for our new graduates. It's an income tax exemption for new graduates for their first 3 years. And I think that would be, another tool in the toolbox, because again, the compact is one tool. The scholarships are one tool. We need as many tools as we can get. So I just hope this committee will take a look at that as well.
Thank you. We're actually looking at that in the Finance Committee, Senator Cummings and I. So it's a good crossover between the two committees. Well, I think it's time for us to take a break for 10 minutes. And I just want to thank all of our witnesses, Ellen and Lauren and Deb and Meredith and Laura. You all have been extremely helpful to us today. So thank you for taking the time to be here. And I'm sure we'll see you again soon on another issue or this one again. So thank you all. And committee will take a 10-minute break. If Nellie, if you can take us off YouTube for 10 minutes, just be back and we'll go over the language about audio only, and Jen will take us through that language. So thank you, everyone.
Thank
very
you very much. Bye-bye.
Bye.